Non-communicable diseases are taking a toll in Uganda, with 2 million Ugandans reported to be battling with diseases like diabetes, cancer and heart-related diseases. According to a latest survey by civil society organizations, little progress is being made in reducing premature death and disability from non-communicable and nutritional diseases.
95% of patients with non-communicable diseases don't have symptoms. And we are living in a country which is used to seeing communicable diseases. And yet these communicable diseases have symptoms. When you have malaria, you have a headache, you have abdominal pain, you have pain in the legs. Yet when you have diabetes, hypertension, these symptoms are not there. So when you go to hospital, the doctor will suspect those communicable diseases much more than he would suspect the non-communicable diseases.
Statistics indicate that 80% of these patients are not aware that they are suffering from non-communicable diseases, which is a major cause of death. Civil society organizations are concerned that government is paying less attention to such ailments and instead focusing on communicable diseases, leaving such patients vulnerable.
Right now, the attention to NCDs in most African countries is so small, so it will discourage any donor. By not prioritizing the problem, by at least getting an overview, they signal to donors that this problem is not serious. The Danish NCD Alliance, together with the Uganda NCD Alliance, urges the government of Uganda to take the NCDs serious.
We would like to emphasize prevention, prevention and prevention. As you are aware of how stressed our health system is, and with available resources, we are unable to treat the increasing number of NCDs and their complications.
As a result, many patients are resorting to traditional medicines since many cannot afford to bear the costs of treating non-communicable diseases. This worrying trend is attributed to poor lifestyles, and Ugandans who are overweight are more susceptible to communicable diseases.
I knew diabetes was a disease that was for older people, and then I thought you really have to be a person who eats a lot of fats, has a lot of sugar all the time.
Non-communicable diseases are increasing in our population because we are adopting unhealthy lifestyles. We are eating excessively, eating poorly. We are eating poorly. We are increasingly using tobacco and alcohol, and we are inactive.
The group has embarked on a nationwide campaign to compile data relating to non-communicable diseases, which government can rely on to assist patients. A recent World Health Organization survey indicated that 36.1 million people died from conditions such as heart diseases, stroke, chronic lung diseases, cancers and diabetes. Nearly 80% of these deaths occurred in low and middle-income countries, Uganda inclusive. Stella Nabakoza, WBS TV.